So let's go to the tribological problems or the articulation itself. It will be a little bit of introduction, a little bit of registry data, and a little bit of personal opinion, of course. It began with Metalonmetal. On the left side, you see the first total hip prosthesis. It was a steel on steel articulation, but only in the 1950s, the McKee prosthesis was the first that was seen as the first working metal-on-metal articulation. And the good success of this metal-on-metal bearing led to the revival in the 1990s that gave enormous problems, on one hand, due to the metals in use, on the other hand, the surgical techniques like the McMinn cup on the right side. The second one was the low friction arthroplasty. As we heard today already, it was not polyethylene, the first choice of Chanley, it was Teflon. And this was not a good solution. So in the 1960s, polyethylene was introduced. During the 60s, the ultra-molecular high polyethylene was introduced as a next step. And in the 90s, the highly cross-linked poly by radiation or with vitamin E. And the third big part is ceramic on ceramic. It was introduced in the 70s, and early in the 70s, the combination ceramic on poly. So we are faced with all possible combinations, ceramic on ceramic and two types of poly, metal on metal, and the two types of poly. As we learned today, metal on poly still in Sweden is the most often used combination. I think in German-speaking countries, ceramic on ceramic and ceramic on highly cross-linked poly are the two main components. When you see in the registries, there are some articulations that definitely failed, and this is especially metal on metal, and in this combination, mainly the large heads. What is the requirement? We want longevity, high longevity in respect of wear and avoiding breakage. We want to have unrestricted function, the squeaking problem. It should be insensitive to implantation errors, namely impingement. And the younger you are, you want no limitations for possible revisions. I just mentioned that the old dogma, once ceramic, always ceramic. Maybe we can discuss on that later. And lab results showed, beyond doubt, the best wear properties for modern ceramic on ceramic articulations. But the ceramic on ceramic has some problems too. The pro is a very low ceramic wear rate, and if wear happens, the particle activity, the biological of particles are lowest. But on the contrary, we are faced with ceramic liner fractures, with squeaking, damage of the ceramic ring, and concerns related to revisions, as I mentioned. The ceramic on ceramic squeaking, I think there's enough evidence that this is a problem of construction, especially the inlays with the metallic ring, and especially implants from certain companies. So this is more a local phenomenon. I personally have only seen it once, and I know colleagues see it regularly. When we look into the registry data, the survivorship, the left top Australia graph shows again the metal-on-metal large head problem. But if you look in all the registries, the modern bearings are very close together. So we need an interpretation of these data. And let's go to the meta-analysis. When you remember the pyramid of evidence, the randomized controlled trials or the meta-analysis, including those RCTs, are our top instruments for interpretation. In this study, 8 randomized controlled trials, including 1,700 primary hips, they conclude that ceramic on ceramic has, of course, better wear resistance, a lower osteolysis rate, but a higher fracture rate and a higher rate of hip noise. And they conclude that there's insufficient evidence to identify any clinical advantage of ceramic on ceramic compared to ceramic on poly. A bigger meta-analysis, 40 randomized controlled trials, over 5,000 primary hips, and they conclude similar survivorship among ceramic on ceramic, ceramic on cross-linked poly, ceramic on highly cross-linked poly, and metal on microphone, and metal on highly cross-linked poly implants. And they all likely have superiority compared to metal on metal and metal on poly implants. This study is an interpretation of the New Zealand Joint Registry data, including more than 100,000 primary hips. And even in this study, ceramic on highly cross-linked poly remained the most durable and successful coupling. And they stratified the data and concluded this is irrespective of age, gender, and size of the femoral head. And even bigger study, the Dutch Arthroplasty register with over 200,000 primary hips, and they have an interesting subgroup of over 34,000 hips in patients younger than 60 years. And they also concluded there's a lower midterm result revision of ceramic on highly cross-linked, ceramic on ceramic, and oxinium on highly cross-linked poly compared to traditional metal on poly, but no difference between the 3 components in the beta group. My personal experience, I personally have early experience with all types of bearings because my former professor was the author of this cup. This was, in my opinion, the first cup where it was able to insert ceramic, metal, and poly, ceramic without a sandwich construction. So we had really early experience. In my nowadays experience, we have continuous revision of ceramic fractures, but this is, to be not unfair, this is always the old ceramic, the second generation ceramic. I personally see squeaking only in extremely rare cases, but I have never had revision of a highly cross-linked poly for reason of wear or osteolysis since 20 years. And I never had problems with highly cross-linked poly in younger patients, in every case combined with modern ceramic. And therefore, according to my personal experience and my personal interpretation of the literature, hard on soft really is the right articulation for every patient.